this is really about xylitol as a health benefit. I'm really excited about it, not only for my own patients, but I think for the general public, and that's part of the reason why I am here today, is to be able to sort of help educate others, whether or not you ever become a patient of mine. The first thing is what is xylitol? And it's a natural substance that comes from plants, hardwood trees, corn cobs. It's actually found in a lot of fruits. It's a naturally occurring substance, and actually our bodies actually make xylitol in the process of the glucose metabolism. We actually make our own xylitol every day as an intermediary in metabolism. So it's a totally natural substance. Some of the features, as we can see, is that it's sweet, and if anybody has not had the opportunity, we have at our booth here, we have strawberries that we're dipping in the actual crystalline xylitol, which looks and works just like table sugar. It's got about the same sweetness as table sugar. It has no aftertaste, and it's good for you. You can see here that it is lower in calories. It's about 40% less than regular sugar. And low glycemic means that as you eat it, as it gets into your bloodstream, it doesn't create a rise in blood sugar like regular sugar will, which is the whole process of your pancreas having to create insulin and monitor that sugar level. So it's actually an excellent thing for diabetics. It is used more in Europe as an IV solution, to be able to do energy. Obviously, decay and helping the oral environment is where I really come in as a dentist. And one of the things that we've also found is that it's impressive in what it's doing in the sinus and in the ear. And for people that have children and grandchildren, the reduction in middle ear infections is phenomenal. And this is just, the studies that were done were just with chewing gum, not necessarily with actually using the spray. So we have, in our practice, we have a lot of patients that, in doing our medical history, we look at sinus. We ask about the sinuses, and surprisingly, a lot of people suffer with allergies and sinus problems, and it's amazing how many people have been able to come off of steroid nasal sprays and have been able to even sort of kick beginning sinus infections with the use of xylitol in a nasal spray up the nose. The last benefit there is that it actually helps you feel full sooner, which is one of the problems that we all have, is that we eat too much. Oops. A little bit about the history. It was discovered over 100 years ago, and it was during World War II when there were shortages of sugar that they finally figured out how to synthesize it. And it was in Europe, actually. And we already talked about the fact that it's really good for diabetics. And it has actually been looked at pretty thoroughly by recognized bodies, health bodies. So this is not just a fad or something that all of a sudden has come out. And as a matter of fact, you can see here the Surgeon General has looked at it. And here we're looking at dental cavities, dental caries, as the single most common chronic disease of childhood. And use of xylitol by children can just almost eliminate decay. So the National Institute of Health, which is our own government, which is recommending it, you can see here as a positive thing here in reducing caries. And actually, our own armed forces, the U.S. Army, is putting xylitol in rations. At this point now, our soldiers are actually getting xylitol in Iraq as part of what the U.S. Army feels is the best nutrition for them. And you can see it's also being used in other countries. Finland, as I said earlier, is the leader in the whole research and understanding of and use of xylitol. I just wanted to sort of glance a little bit on how sugar is, and I don't want to read a lot of my slides, but I want to read this one because I think this is really powerful. Sugar is processed by heating it up in chalk milk so that the calcium and protein are extracted, becoming an alkaloid, thus destroying all vitamin content. It is then mixed with acid chalk, carbonic gas, sulfuric dioxide, and natrium bicarbonate. Then it is cooked and cooled off several times, therefore crystallized. This dead mass is then treated with strontium hydroxide. It is passed over chalk carbon acid to clean it. Dark coloring is removed by adding sulfuric acid, and then it is filtered with bone charcoal. Finally, it is colored with indanthrene blue or highly toxic ultramarine.
Yeah. Give me some of that. Sounds good.
And the amount of sugar that is consumed per capita in this country is staggering. It's almost a half a pound a day.
Would that be the same?
Obviously, it's in a lot of pies. And diabetes. You know, the pancreas can only produce so much insulin in its lifetime, and all of a sudden, we're now at the doctor and we're needing insulin. And this graph here sort of starts in the 1800s and comes over to present, and this is the amount of sugar consumption that we have as a country has gone through. And here's the rise in diabetes, and looking at the number of people in 100,000. So you can see that they're pretty proportional, those two graphs. Here's what they call a glycemic index, and this is one of the advantages of xylitol, is that once it gets into your bloodstream, it doesn't create that rise in blood sugar, which is what makes the pancreas and have to secrete insulin to regulate that. So this is one of the advantages that it really has for diabetics. And actually, if you went to Wild Oats and looked in the diabetic section for some of the foods that are sweetened, they are sweetened with xylitol. So you know, it is out there. Basically, xylitol is considered a sugar alcohol. It's not really a sugar. And polyol is sort of the official term. And here's some of the effects of it. It is one of the things that is a point, is that if you eat too much of it, you actually can create a little bit of diarrhea. The body will actually get used to it. That's probably the only real negative effect. It's actually safe for nursing mothers, for infants. It's totally a safe product. There's a bunch of these other sugar alcohols. Some of the other ones that you'll see are sorbitol, mannitol, are ones that you'll see sometimes on products. But we're really concentrating on xylitol because it's different than the others. And what makes it different is that it's a 5-carbon instead of a 6-carbon sugar. And what that means is that the Streptococcus bacteria, which is one of 300 bacteria that can be isolated in the mouth, but is really the culprit in the majority of dental disease, particularly dental decay. And the Streptococcus bacteria is also what is strep throat, bronchial infections, ear infections, sinus infections, cousins to the Streptococcus mutans. But they're also strep bacteria. Obviously, everybody's heard of strep throat. And what happens is the Streptococcus bacteria loves it. It wants the sugar. It treats it. It actually goes after it even more than regular table sugar. It can't metabolize it. It doesn't really kill it, but once it can't metabolize it, it renders it basically ineffective. And we're going to get into, you know, a little bit what the effects are. So from a standpoint as a dentist, you know, let's just go a little bit over, you know, the whole caries process. Okay, we have a tooth, we have germs, bad bacteria, Streptococcus mutans, lactobacilli are the two main culprits in dental caries, and then we have a fermentable carbohydrate, and this isn't just sugar. This is pretzels, breads, fruits, you know, all kinds of carbohydrates can be basically processed by the bacteria in the mouth. As the bacteria eat the carbohydrates, particularly the refined sugars, what they do is they create a sticky substance called plaque. They secrete the sticky stuff that now adheres to the teeth and to the soft tissue membranes, sinuses, lungs, ears, whatever. And now they colonize, and in the teeth, what happens is that one of the byproducts is that the bacteria secrete acid. And at a certain pH level, that acid starts demineralizing or taking the structure away from the tooth. And it turns the tooth into a sort of a lattice work, if you were to look at it on a scanning electron microscope, where the tooth is still intact, but it's porous, and the bacteria can actually get through that porous structure into the inner part of the tooth, which is the dentin, or the inner part of the tooth. Now, that softer inner part of the tooth is the part of the tooth that's alive, and the bacteria now can actually start eating the inside of our tooth. It can decalcify the enamel and get into the inner part of the tooth. Okay, here's a slide that sort of shows some of the caries process. And the white that you see is the demineralization. That's the first step in caries. And eventually, the bacteria will get to the point where it gets through to the inner part of the tooth. And this is actually a patient that we worked on just this week. And I was doing a bridge preparation for her. And where the dental explorer is right here, this white is all decalcification. The brown is actually caries, where the bacteria has actually started to eat the inside of the tooth. In the old days, we felt that once the bacteria was inside the tooth, that there was no other solution than to basically amputate, which means drill the tooth open, drill the enamel open, and the infected decay out, and then put a filling in the tooth. We've now learned that actually with xylitol, we can actually get through the enamel, kill the bacteria on the inside of the teeth, and we now raise the pH in the mouth up to a point where now the same demineralization process can be reversed, and we can now remineralize and rebuild that porous enamel and make it hard and ward off bacteria from coming back in. We can actually reverse decay. Now, what happens though is that when the decay gets bigger, eventually the enamel crumbles. And we actually term that from a scientific standpoint as cavitation, which is where the word cavity comes from. Once that happens, now there's no reversal of the caries process. Then you need to have the filling or the crown, depending upon the extent of the process. And obviously, if it's left untreated, the bacteria continue to eat away the dentin of the tooth and eventually get to the pulp or the inside of the tooth where it infects the tooth. And that's where now we have, you know, pain that maybe some of us have experienced, and the need for either a root canal treatment to remove the infected nerve or an extraction to take the tooth out. This is one of the leading researchers in Finland, and there's a lot of research that has been done on xylitol, and you're going to see, I'm going to give you a website to go to, actually from my own website, www.smiledesignCenter.us. You will be linked to the xylitol research. There's an extensive amount of research that has been done, and this stuff is not hocus pocus, it's proven, you know, and here is sort of a chart that shows what we as dentists measure from an epidemiological standpoint of dental disease is called DFMS, which is decayed, filled, missing surfaces, where, you know, they go and they quantify as time goes on how many more decayed surfaces, how many missing surfaces, how many filled surfaces. And here the red line is for somebody that is on a sugar diet. Blue is on xylitol. So we can see here that over a long term, they've actually, in some of the xylitol studies, they've actually seen that it is actually it's actually reversed, that there's actually been some reversal of the disease. And here's some of the highlights of some of the studies. As you can see, the oral microflora is where, again, we're eliminating the bad bacteria, and actually good bacteria fill in. We don't eliminate the bacteria in the mouth, we never will. But we just are going to a more beneficial flora. And we'll get into the fact about you know, mothers and use of it you know, as from a standpoint of prior to delivery and as their children are young. And one of the things that we found is that once we basically disinfect the mouth with xylitol and we change the oral flora, it's very long lasting. They're going out years and finding that we're not really going ahead and seeing it go back to a negative way. And particularly if we're using a maintenance dose. And that's what we're in our own practice we're doing, is that we're now using toothpaste with xylitol in it. Everybody uses toothpaste. So why not use a toothpaste that's healthy for you? And for the first time, I'm actually thinking that maybe fluoride, which has always been something as dentists we've sort of leaned on to help try and prevent caries, which we know has its own sort of bailiwick. And a lot of you that are here probably know that, you know, if you read from the holistic literature, fluoride is considered sort of a bad thing. We know that in high doses it is toxic. It's a very reactive chemical. We also know as dentists that it works, that it actually helps build the remineralized enamel. Remineralized with fluoride is the strongest. And it really does help to prevent decay, fluoride does. But now we might actually have a solution that's much more natural and healthy for us, and maybe we don't even need to use fluoride. And this is sort of where the current thinking is coming. And some of the fluoride toothpaste, the xylitol toothpaste, are coming with and without fluoride. So, you know, we're doing it both ways. And again here, once the plaque, it loses its ability to secrete acid. And this is really the Streptococcus mutans bacteria. And now, as a result of that, it's less inflammatory. The body's not reacting against it, which is why the body can get healthy, particularly like in the sinuses on the soft tissues. And it loses its ability to adhere, which is now, just by using, and I'm going to have a slide in just a minute here, that sort of shows that just by using the xylitol products, that you'll develop less plaque on your teeth with basically the same brushing. Here we're talking about some more of the research. And I'm sort of a research-oriented guy. When I first learned about this, it sounded too good to be true to me. So I wanted to go ahead and really study it before I would ever use this in my own practice. And I went right away to the scientific literature. And the more I read, the more impressed that I was. And this is available for you all to read if you want to spend the time to really study it. If you remember in grammar school, we would chew the red tablets to determine whether or not you really brushed well and got all the plaque off, the red stains the teeth, and we still use this in our practice today. This is an example of, I believe, 1 week later, the same patient with no change in brushing, the amount of plaque that's on their teeth. Wow. Now, they found that the Streptococcus bacteria is actually transferred from mother to child, or from parent to child, by kissing, sharing food, and the like, and we are basically infecting the kids with the Streptococcus bacteria, which is setting up caries. So there have been some research done that really shows some impressive results, that if the mother starts taking it a few months before she delivers, and then continues taking it through the first few years, that the child doesn't even need to use the xylitol themselves, and the Streptococcus levels and the dental disease are much less. Now, of course, you can still give it to the kids. This is the first time we can give our kids something sweet that's good. We can give them gum and mints, and we can dip a strawberry or put it on their cereal, on a healthy cereal. We can put a sweetener on there that's actually good for them. And again, looking here at graphs, you're seeing the green and the yellow being fluoride and chlorhexidine. And these are, chlorhexidine is an antibacterial mouth rinse that we use in our practice. And sometimes in some of the therapies that we use, we actually will try and kill the bacteria with the chlorhexidine. We'll also use fluoride, and we'll use the xylitol. We're using combinations of treatments depending upon how seriously somebody has what we think are decay issues and problems in their mouth. But comparing the other two magic bullets to xylitol, you can see that, again, decayed, missing, and filled teeth in this one, that the xylitol is just way, way less. You can see 74% cavity reduction. Not all xylitol is the same, though. You need to get enough xylitol to be able to affect the bacteria. And what the research has shown is that you need to be able to use it consistently throughout the day for a number of days. And in speaking to Dr. Peldiak, who is probably the true Dr. Xylitol in this country, he's been involved since the 70s in this country in research, and he's been involved with some of the Finns. And, you know, and he and I have now been in communication. You know, he's sort of my mentor now, and he really did write the book. And we're still developing the strategies and the therapies that we're using for this product. But it's something that Trident, which has xylitol in it, you might read it, the amount of xylitol is basically ineffective. You need to have 4 to 12 grams of xylitol a day, spaced out, and the gums, the pure xylitol gums, give you a whole gram of xylitol in it. And now we're using the toothpaste. People that like mouthwash, there's xylitol mouthwashes. We're using, in some more severe cases, we're actually using bleaching trays and putting xylitol gel in and letting people sleep with it overnight. You won't find any of this at the 7-Eleven. You will find it at the local health food stores. Here's Dr. Peldiak in some of his research. And, you know, and we like to point this out, that xylitol is just part of a strategy for a healthy mouth. And it's not one of those things, again, that, well, if I can go and start using xylitol, now I don't really need to go and have my teeth, you know, evaluated, have my teeth cleaned. I don't need to floss. I don't need to, you know, to take care of myself. So it's really part of an overall strategy. And we're excited at my practice to be sort of really on the cutting edge. I actually spoke to the local dental society recently about xylitol. And surprisingly, I don't think many of them really knew what it was. You know, we've all heard the name. I mean, you've seen it now. The word is starting to show up a little bit more. But to really understand from a scientific basis, it's the health benefits, it's impressive. We've already talked about the sinus benefits. My office manager's mother is an asthmatic, okay, and has started to use the nasal spray and is now off of, for the first time, off of asthma medication. Now, I'm sort of not saying here that, you know, this cures asthma. I had a patient in yesterday that we've started on xylitol just a few weeks ago, and he had to use nasal steroids every day. And now he said, I have to use the xylitol twice a day. You know, and I was like, sounds like a good deal to me. You know, but he's no longer having to use his steroids, and which we know affect your whole body. Here's how you get the xylitol. Toothpaste, we've already talked about with or without fluoride. The tooth gel, and again, some of the strategy, and I'm learning this from the gurus, you know, at the forefront of this field, that the whole idea of putting it in bleaching trays, which actually goes through a full life cycle. If they sleep with it all night, it's the whole life cycle of the bacteria. You know, it's like, I said, wow, that makes sense. And then we'll go ahead and we'll use those same trays for bleaching. We'll give you a discount on bleaching. Gums, mints, mouthwash, mouth spray, which is where you can do a spritzer. It's actually good for dry mouth also, the xylitol. The nasal spray, which is actually a saline with the xylitol in it. And then the crystalline form, which is just like table sugar. Hopefully you share my enthusiasm and my passion. And I would like to thank everybody for, you know, coming and, you know, and hopefully this will maybe help you on your own journeys.